How's everybody doing? My name is Champ Edmunds. I represent House District 100, which is south part of Missoula County, Lolo out to Frenchtown area. There is a conservative in Missoula. I think I'm it. I'm kind of sore today. I played basketball last night with the legislative and senator team, and first time I've exercised since dragging elk off the mountain in November, so I'm hurting today. So if I look like I'm moving funny, that's why. But I was thinking I wouldn't be offensive when I got up here, but I'm going to offend some people anyway. It's revolved the term Obamacare. We need to use that. The left is really good at changing the names of things to make them sound better. We changed socialism to progressivism. If you don't know what progressivism is, and somebody says, "Are you progressive?" What's the opposite of progressive? Going backwards. So we're going to say, of course I'm progressive, but they know how important it is to say Patient Protection and Affordable Care Act, because if they say it long enough, maybe people will start believing it, even though it doesn't protect and it's not affordable. But you heard Kerry Smith talk about House Bill 312, which is the Interstate Compact for Healthcare Freedom. My bill, House Bill 526, is another interstate healthcare compact. These two bills take a little different approach to achieve the same thing. And I'll try to go fast since Kerry went over. Basically, they're two sides of the same coin. We need both of these interstate compact bills to get control of health care decisions back to Montana. Kerry's bill takes a legal approach, citing sections of the U.S. Code. My bill takes a political approach using Article 1, Section 10 of the Constitution to allow the states to collectively request congressional consent. My bill also returns the federal funding that Montana citizens pay into federal health care back to Montana to use as we decide. Again, an interstate compact is an agreement among several states that is enacted into law in each participating state. A few examples of interstate compacts adopted in Montana are the Interstate Library Compact, Interstate Compact on Juveniles, Interstate Compact on mental health, and Driver's License Compact. The compact is not a new concept. There are over 200 interstate compacts in use across the United States. House Bill 526 is Interstate Healthcare Compact. The purpose of this healthcare compact is bringing several states together, giving them strength of numbers approach Congress together. Asking Congress to give the participating states the option to return all or a portion of federal healthcare regulation and the associated funding, which is the Medicare costs that we're sending to Washington, back to the participating states. A compact must be enacted in substantially the same form in each participating state, and we're now working closely with over 30 states to pass legislation to join the compact. The purpose of House Bill 526 is to give the participating states the authority to collectively ask Congress for consent to allow the participating states to pass future healthcare regulation that would supersede federal health care laws. The most important thing to understand is that House Bill 526 does not change or establish any health care regulation, policies, or programs. The states are not getting together to write new health care legislation. They're getting together to ask Congress for approval to develop future health care programs within the individual states. The other important thing to know is it doesn't become effective until Congress gives consent and puts it into federal law. At that time, once in the federal law, hopefully by the next legislative session in 2013, Montana can write legislation to implement in Montana or all or a portion of federal health care regulation and the associated funding. So assume House Bill 526 passes and at least one other state passes their compact. It goes into Congress and gets consent. No health care programs have changed. Medicare, Medicaid, S-CHIP, Obamacare, all remain the same until sometime in the future. The Montana legislature enacts legislation to bring all or a portion of health care regulation back to Montana. There are three separate stages. This bill only completes the first, which is to pass enabling legislation, which is House Bill 526. The next is for Congress to consent. And the next is, in the next legislative session, for Montana to write actual health care regulatory changes into law. An example is, imagine it's 2013 right now. Assume House Bill 526 passed this session and Montana and the other participating states got congressional consent. Suppose we in Montana believe we can do a better job for our seniors than the federal government is doing with Medicare. So we pass legislation based on the federal law that gives us the authority to take the money Montana citizens are paying into Medicare, into the Medicare Trust Fund, and use it in Montana to create our own senior care program. All the other federal health care programs will remain in place unless and until Montana chooses to pass legislation to change them. The point is that any or all of the money Montana citizens give to the federal government for health care could come back to Montana, and Montana could decide how best to provide health care for Montanans. There's a couple of things that people were confused about during testimony and the hearings. One is the purpose of the compact is not for states to get together and develop cross-state health care solutions. The only purpose for the states is to get together in this compact is for the states to go collectively to Congress to get health care regulation and funding returned to the states. After that, we are free to develop health care solutions in Montana as we decide is best for Montanans. Second, there is a health care commission that is established in the compact. This is not a new bureaucracy. It doesn't have anything to do with money. It doesn't have anything to do with setting policy. It is established to do only three things. One is to collect information like cost and price data to assist the states in developing their own healthcare systems. Two is to study issues related to healthcare regulation. And three is to make non-binding recommendations to the participating states on healthcare policy. The third question people ask is funding. The funding we're talking about is money Montana citizens already pay into health, Medicare, Medicaid, S-CHIP, and eventually Obamacare. This is not new federal money coming into Montana. It's Montana money coming back to Montana. The compact uses a definition of health care taken from the implementing regulations of the Federal Social Security Act, which specifically excludes veterans and Indians. So in closing, this bill is not health care reform, it's governance reform. This bill does not establish or change health care policy. It sets up an option for Montanans to decide the best health care program for Montana and how the money should be spent. The issue isn't what health care program is best. The issue is who decides. Does the federal government decide the best health care program for Montana, or does Montana decide? I also ask for your support of House Bill 526. It gives Montana options. If federal health care is working great in Montana in 2013, we can do nothing. But if parts of the federal health care program are not working so well, we bring that part back to Montana along with the funds. The bottom line is Montana decides. If you like this, and I recommend you contact the Senate, but I think Senator Priest is the head of that committee, so he's going to get that through. But contact the governor's office and ask him to pass it, because he may decide he doesn't like it as much as we do. Thanks.